Miss Sarah Lee.
Mrs. Sarah Lee, an 80-year-old woman here from Montgomery, Alabama. She had hip surgery before on 10/18/05. That was our surgery on the left hip. And she also had previous surgery in January '05 in the same year. Ms. Lee now will describe the difference between surgery on the right versus the surgery we did on the left.
Let's misrepresent this. My surgeon in Montgomery was excellent surgeon.
No problem.
I had no problems, no complications. Everything went just the way it was supposed to go.
Right.
The recovery took longer than I expected, but it was uncharted territory. I didn't know how long it should take. It took longer, so when I began to get ready for the other one, which I knew was coming, again I talked to my friend John Mitchell, who's a doctor, the eye doctor there. He said, go back and see Dr. Bramlett. So I came here for a consultation. I was so impressed with everything we saw, we signed up. The surgery done on the 18th of October was unbelievably easy for me. I don't remember anything about the first day. People told me I said things I don't remember. But I was walking with a walker, you know, the next day or that day. And pretty soon, a week or so later, I was using a cane. I still take a cane when I go out, but I don't have to have it. I forget where it is, in fact. And it's almost more trouble than it's worth right now. And so I would highly recommend this procedure to anybody that would ask.
Okay, regarding your pain, one side versus the other, how much pain post-operatively did you have compare the two?
Well, I guess it was less pain with this one because I took pain medicine longer with the other one.
How long did you take pain medicine with the other one?
I took pain medicine for about 3 weeks. I was in rehab for 2 weeks. Okay. And I took pain medicine the whole time I was there. They recommended that I take it before each session of exercise. The week that I got home, I began to take myself off of the pain medicine, and I've only used Tylenol. Now here, with this one, I may have used 1 or 2 pain pills that I already had on hand, maybe the day I got home.
And that's it?
And that was it, just right. Tylenol. Okay. Tylenol is all that I've used since
As far as sitting and getting out of a chair, which side was it easier to get out of a chair with?
I don't know.
Do you have any comparison?
No, it's not easy to get out of a chair no matter what.
Right.
I have to have arms.
Which one has it been easier? Have you found any difference in easier to walk with one versus the other?
Well, now there's not much difference, but this one walks better a lot sooner. The left leg, I walk more easily.
Within what time frame?
Almost immediately.
Yeah. And with the right side, how long?
I'm getting old, I forget.
Right.
A lot longer.
Yeah.
Well, I would say a lot longer.
Okay. How soon could you drive after your first right hip?
It was about 7 weeks or 8 weeks because it was the right hip and I used my right foot. Usually he lets you drive in 6 weeks, but he told me to wait another couple of weeks because of it, you know, you use your right foot more.
How soon could you get in and out of the car with your left leg?
I could get in and out of the car sooner than that. I just didn't drive.
Yeah.
My left leg, I didn't have really much trouble getting in, going home from the hospital. Somebody helped me one time, and then after that I could do it myself. It was slow, and I kind of had to pick it up myself, but then it was soon, it wasn't long before I could just pick up both knees and get them in easily, and I could drive in about 2 weeks.
In summary, how quick were you back to your relative normal on the right hip?
You say 2 months, maybe.
Okay. And how soon were you relatively back to your normal on your left hip?
Well, just a few weeks, I guess.
Okay. Okay.
You know, it just got better each day, improved over the day before.
Okay.
It was continuous improvement.